One of Donald Trump's former favorite science advisors at Health and Human Services, a man by the name of Paul Alexander, emails were revealed this week that showed that Mr. Alexander had in fact not just been pushing the herd immunity theory that would leave millions of Americans dead, but he also wanted to intentionally infect what he called the non-vulnerable parts of the U.S. population. Here is what the email read. This is from Health and Human Services. So the bottom line is, if it is more infectious now, the issue is who cares? If it is causing more cases in young, my word is who cares? As long as we make sensible decisions and protect the elderly in nursing homes, we must go on with life. Who cares if we test more and get more positive tests? We essentially took off the battlefield the most potent weapon we had: younger, healthy people, children, teens, young people who we needed to fastly infect themselves, spread it around, develop immunity, and help stop the spread. So this idiot, because there's really no other word to use to describe him, wanted our kids to go out there, get infected, spread it, because kids aren't affected by it. That's a lie, by the way. Kids are infected. Kids are affected, whichever one of that it is. Kids can have symptoms. Kids can die from this. Kids in the United States have died from this. And we're only just now, because this thing's only about a year or so old, we're just now finding out that, it can cause brain problems. Mr. Alexander, it can also cause male impotence in some extreme cases. So, yeah. See, that's the problem with new fancy diseases, right? We don't quite know what the long-term effects are going to be because we haven't seen them long-term yet. We're starting to, and it's not good. About 20% of people who have had this, according to the latest numbers, have developed some kind of neurological symptoms, lasting neurological symptoms, impairment, if you will, of their brains. And this Yahoo was out there saying, we should infect more people. We should get them infected. Slow the spread by increasing the spread. Because he says, help stop the spread. But his plan wasn't to stop the spread. His plan was to increase the spread, to eventually stop it. Yeah, sure. If everybody on the planet has been infected with this thing, most everybody would have the antibodies, wouldn't be able to spread. Sure. But hundreds of millions of people would die across the planet if we did that, millions in the U.S. alone. That's why herd immunity is a stupid strategy. What we could have done as a country instead was have the federal government issue a mask mandate. Have the federal government put literally any policy in place that would have helped people. And for the folks who lost their jobs because of, you couldn't have restaurants open or bars or resorts or things like that, we could have done better stimulus to keep them above water during the pandemic, which probably could have been just about over by now if we had done those things. Instead, we had a patchwork of 50 different states putting 50 different regulations in place, no uniformity whatsoever. Some governors, most of them in red states, denying any kind of enforcement. Other states going overboard, but then not overboard, but going hard on it and then rescinding them too fast. Then they see spikes. We needed a federal response to this, and we didn't get one. Why? Because Donald Trump was listening to idiots like Paul Alexander instead of the medical experts who said social distance and wear a mask. That's all we were asked to do. But our arrogant American selves couldn't even do that.